In May, 60% of Gaza's water and sanitation infrastructure had been destroyed or severely damaged, and nearly 2 million people were displaced and living in crowded conditions, setting the stage for a massive public health crisis. And a few months after, an unvaccinated 11-month-old boy was confirmed to be partially paralyzed by polio, the first case in Gaza in 25 years. In early September, around 90% of children under 10 in the Gaza Strip have received a dose of the polio vaccine following the first round of an emergency vaccination campaign conducted by UNICEF and partners. I'm now joined by Dr. Abhishek Raut, medical director at Appletree Medical Group, to further discuss polio. Dr. Raut, thank you for joining us.
Good to be here.
Now, what is polio and why was it so important to begin distributing a polio vaccine in Gaza?
Right. Well, polio is a highly infectious viral disease, primarily affecting young children. It's transmitted through contaminated food and water or contact with an infected person. So it'll multiply in our intestine where it can invade the nervous system as well. Certain infected individuals might not show too many symptoms, but some can develop quite severe symptoms, including paralysis, which can be permanent. And in very severe cases, we can see polio actually leading to death because of the immobilization of the muscles used for breathing. Now, as you mentioned, Gaza is a densely populated area with very limited access to clean water and sanitation. So we see this as a particularly vulnerable area for the spread of infectious diseases like polio. The concern here, of course, is that we have many children who are very susceptible to the outbreaks of preventable diseases. So this campaign, really, the objectives are to prevent outbreaks for polio and also protect vulnerable populations like the children in Gaza.
Now, the UN has announced they will be adding nutrients to the second round of polio vaccines. Why would that be?
So that's very interesting because that initiative is addressing not just the immediate need to protect children from polio, but also to tackle much broader health challenges faced by the population in Gaza. Nutritional deficiencies being quite a strong force there. So many children in Gaza do suffer from malnutrition, and the statistics will shock you. More than 90% of children in Gaza have severe threats to survival, growth, or development because of malnutrition. So adding these nutrients, essential vitamins and minerals, along with the polio vaccine, the idea is to really boost the overall health and nutritional status of these children.
Now, as I mentioned, 90% of the children in Gaza have received the polio vaccine. And you did mention that children are more susceptible to polio. Why is that? And are there other targeted populations at a greater risk of contracting polio?
Right. So children, particularly those under 5, are at a much more susceptible risk of polio. And there's a lot of factors because of that. So immature immune systems being number one. Young children have developing immune systems and are not fully capable of fighting advanced infections like polio. There's also a close contact and hygiene, especially in that age group where children will play in close proximity to each other and may not necessarily use regular hand hygiene as well. Other risk groups are also those without good immunity in general. So a lot of children may typically lack prior immunity to polio without the vaccine, so that also puts them at risks.
Now, after
Overall, we also see other groups such as pregnant women and even travelers that put them at specific risk as well.
Now, after it appeared like we had eradicated polio, why does it keep popping up in regions around the world?
Yes, I think this is one of the things where we always hoped that we would completely eradicate polio, but we haven't been able to reach that full vaccination coverage worldwide. And so that's why we see polio resurfacing here and there. Even a small percentage of unvaccinated individuals can cause that virus to spread. So certainly we do see those challenges in many zones. We see them especially in conflict zones because we have a poor healthcare infrastructure and not necessarily the resources or even the food and water without contamination.
And is there a risk of polio coming back to Canada?
That's a very good question. I think if we look at it, we've been really polio free since 1994. There was maybe one case in 2022, but that was a very isolated case, didn't result in any pandemic or epidemics. So overall, the risk remains low, but I think we have to keep very vigilant because we're still very much a global country, and global travel can certainly bring the virus to us as well.
Now, we do just have under a minute, but I'm curious, other than providing vaccines, is there anything Canadian doctors or Canadians in general can do to support Gaza in preventing polio from spreading?
Right. So I think the biggest thing to keep in mind is with any infectious disease, just having proper nutrition is crucial to enhance vaccine efficiency. If we talk about polio or if we talk about any other infectious disease, if you have a stronger immune system because you have the macro and micronutrients, you're going to have less issues with the disease or even developing the disease. So a more holistic approach to medicine and child health, focusing on nutrition, would probably be the best thing for conflict zones such as Gaza.
Dr. Raut, thank you so much.
Thanks so much for having me.